Are you hungry? I don't know, maybe it's a while since lunch. But if not, just think about it for a minute. How does being hungry make you feel? How does it change the way you think? Just park that thought for a minute. I'm a nurse and I've done a little bit of extra training, which means I can prescribe medication in much the same way that a doctor can. But would it surprise you to know that sometimes I don't want to prescribe medication? I know about how important it is for so many people, and for so many conditions it's crucial. But sometimes what I actually want to prescribe is a muddy pair of walking boots, because I want my patients to get outside and exercise more. Sometimes I want to prescribe them a mug of tea and a chat with a friend, because believe it or not, friendship can improve your health more than medicine, maybe. I left school at 16 with a handful of very basic GCSEs. I got a job and came here to Keighley College 1 day a week, maybe like some of you here. I did make it to university by the age of 25, and I qualified as a nurse and then had a brilliant few years, to be honest. I nursed all over the world, from hospitals to helicopters, even on cruise ships. Eventually I made it home to Keighley, and now I'm a nurse at a doctor's surgery just a couple of miles away. And so many of the people that I see don't need a very medical approach to their health because their problems are social. There's so much more to good health than just good physical health. For instance, somebody may come and see me because they're drinking too much alcohol. And obviously they need medication and referral and tests. But maybe they're drinking too much alcohol because they lost their job, and maybe losing their job has put them into debt. You can see just from that very simple example how somebody like that needs more than medicine. They need somebody to help them find their way. Another example is loneliness. Would you believe me if I told you that research is now showing that if you describe yourself as lonely or isolated, you're up to 30% more likely to have a heart attack. And it doesn't stop there. You're up to 50% more likely to suffer from dementia. These problems that I'm talking about now all come under the umbrella term of something called social prescribing. Social prescribers are crucial people, and they work as part of the GP team, and they are a powerful link between the patients we see and the community services that are out there to help them. They empower people, they give them motivation, and they help connect people to these services. And you don't need to see a doctor to see a social prescriber, and lots of times they can do you far more good. We are so fortunate. There are some amazing services right here in this community. If you're feeling really low and down, there's a group you can go to for a cup of tea, cup of coffee and a chat. If you're expecting a baby and you're struggling for money, there's an organisation that can help provide you with lots of the equipment that you need to look after a newborn baby. If you're looking after a relative with dementia and you're worried about how they're coping or even how you're coping, there's an organisation for that too. But how on earth do you find them? Just think about it for a minute. If you want to buy something and you need it delivered to your home tomorrow, you know exactly where to go to shop. If you want to book a holiday or get some food delivered, there are loads of really easy to access websites out there that can help you spend your money without any problem. But what if that's not what you need? What if what you need is help and advice because you're worried about a friend who you think may be self-harming? Or maybe you're worried about your own alcohol intake. How do you go about looking for help then? The World Wide Web is, by definition, a big place. And where do you go to start looking for help when you need something right on your doorstep? This problem is something that really struck home to me on a cold December day back in 2019. We had no idea what the world had in store for us in 2020. I was at work in the doctor's surgery. I was seeing patients in 10-minute time slots, and apologies, but it's true, no doubt I was running late. I do. Probably I was wondering how long till lunch. And my next patient that came in, let's call them patient 0, I could see from their notes they'd seen a doctor, they'd had tests, but nothing had been found to indicate what the source of the problem was. As a nurse, hungry and running late, this is not good news for me. I'm not a doctor. We already have negative results. What can I add to this? So I did the only thing I could. I sat and simply listened. And as I listened, I knew exactly what the problem was, and I knew the patient didn't want to tell me, because this couldn't be summed up in a medical diagnosis. It couldn't be found on tests. So when they'd finished speaking, I really gently asked, "Are you hungry?" And they nodded. Of course, I asked about whether they'd been to the nearest food bank, but they didn't have the bus fare to get there, let alone the strength to get home with the food. So I did the next thing, and I referred the patient to a social prescriber. But the social prescribers list was full. The waiting list for the social prescribers list was full. Such was the need in our community, even back in 2019. So I just took the next simple step. I contacted a couple of community churches, put them in contact, and got us some help and support. But in doing that, it became obvious that we needed a food bank far closer than 3 miles away in Keighley. So Worth Valley Food Bank was set up. It opened its doors in February 2020 and immediately had a steady stream of people coming in. Just a month later, March 2020, the first national lockdown was announced. Talk about timing. I was over the road in the medical centre and life was completely different. The challenges to our work had changed. We'd always struggled to work out what the best services were to send our patients to, but it was suddenly much worse. Social prescribers, doctors and nurses couldn't keep up. Services were opening and closing so fast. I'm sure you all remember those days. When I was across the road in the food bank talking to people there, strangely enough, they had just the same problem as we did in the medical centre. They'd got to where they were quite often times because life had got tricky and they hadn't known where to turn. Information poverty was staring me in the face. At work, we were struggling with it day to day. But the people in the food bank were suffering it in their day-to-day lives. Nobody knew where to go for help. And I just had to do something about it. Now, I'm a nurse. I like to think I'm a good nurse. I love my job, but I had no idea how to set up a website or start a new service. But it was amazing how fast I found help and support. I found a brilliant web designer who understood exactly what I wanted and produced the site I needed without us ever meeting. This is still in lockdown, remember. I found a little bit of funding to pay him, and Treacle.me went live in 2020, July 2020 to be exact. Treacle.me is a social prescribing website, and I don't think it's been done before. All it does is take the biggest national organisations and helplines, along with the smallest community groups, and it puts them all in one place that's really simple, easy to use and free to access, so that anybody needing help can find the help and support they need. Just imagine a world where anyone that needs the sort of help that we've been talking about and lots of other things besides knows exactly where to go for help. Just imagine a world where you don't have to sit at home alone wondering if anyone has ever suffered in the same way you have, because you know exactly where to go for help and support. If I can just leave you with one thought, it's this: it doesn't matter how old you are, or who you are, or what your experience is. If you see a problem and you think you can fix it, go for it. You'll be amazed of the amount of support and help that's out there that'll help you get to your goals, and you might just surprise yourself at how far you get. Thank you.